Hi, everyone. I wanted to introduce Carrie Bullock, who is now doing body work treatments in my office on Fridays and some weekends and late afternoons as well. I've known Carrie for, gosh, 6 or 7 years now, and I'm very happy to have her working in my office and seeing clients. She has a really varied background, and she also offers some very unique massage and body work therapies that she's going to talk about. So just wanted to welcome her. And um, so, Carrie, I wanted you to perhaps discuss a little bit your background, and then we can get into what you're doing currently and what you're offering in my office.
Okay, well, thank you so much, Abigail, for inviting me today. I feel honored. I have a varied background. I started my professional life as a biologist. I have a bachelor's degree in biology and zoology with an emphasis in marine biology. So I was a marine biologist, worked in the field and doing research and in laboratories for about 8 years. And then I got my master's degree in science education. I wanted to be a science teacher. And so I worked in various states doing that, but ended up on Maui for 10 years. And while I was teaching, I used to work on boats to support my teaching habit. And I fell into a boat hatch and I hurt my shoulder. It wasn't bad, it was no big deal, no treatments, but it kept getting worse and worse and worse. And then it became a neck thing, like I couldn't move my arm, and I tried everything, and this went on for years. And I came back to Colorado to help my family and started over here, and I ended up at an orthopedic pain doctor who did microcurrent therapy. And so that's how I came to be with what I'm doing now. She diagnosed me with fibromyalgia, cervical trauma fibro, and worked on my shoulder, but it was game changing for me. It just turned everything around. And so I figured when I wanted to take a break from teaching, I would like to do this to help other people and share that treatment with them. So I got a massage license so I could that would support that doing microcurrent. And in all of the microcurrent advanced trainings that I went to, there were a lot of really exceptional trigger point therapists. And so I looked into that and decided that would be perfect for me because of my strong science background. It's very clinical based, like a clinical analysis or scientific analysis. And so it kind of fit with me really well. So I have about over, I don't even know, I've stopped keeping track, over like 150 hours of advanced trigger point training. So it's a whole, was a 2 year program. And I don't even know how many hours of microcurrent. It's an ongoing evolution because new developments are made pretty much every day. When one professional gets trained and goes back and treats people within their profession, they present case studies, and so we're constantly learning new information, which I love. So I am a licensed massage therapist and a myofascial trigger point therapist, and I specialize in helping people find and treat the root cause of what's causing, whether it's pain, weakness, numbness, tingling, restricted range of motion, anything muscle or fascia related. And I'm loving it. It's I wonder if you can edit this. Good question.
That's okay. Yeah. So, do you want to tell us a little bit more about what trigger point therapy is and what makes it different from just like a regular massage?
Yeah, so there's a lot of confusion there. It's not just working on a specific sore area or not. Trigger point therapy is actually a outcome-based protocol. So it's a whole process. And it includes a really in-depth look at your history, very complete and detailed all the way back to birth and even sometimes before birth. There can be injuries or events that affect your muscles and your fascia for the rest of your life. And it includes, so a typical session would include uh, lots of, the first session is an evaluation and treatment. So it includes range of motion assessment, postural and structural assessment, looking at everything physically on your body, how you stack up, even your feet. I've been really into feet lately. Don't mind me if you see me like staring around. I'm assessing what's going on all the way up to your neck and even headaches with your feet. But it's evaluation, and then it's looking at perpetuating factors, and that's the big thing because we're trying to figure out the underlying cause here. So what's happened to create the situation that you're in with these sensations caused by trigger points, whether it's pain, numbness, weakness, restricted range of motion, and that could be anything from sleep posture, seated posture, um, sports that you used to do, your occupation. I mean, it's an in-depth. I have a very long intake form, and then I do a very detailed phone consultation with people before they even come in, so I can get all of these little details. Um, and then it could just be there's a broad range of techniques that I use to actually treat with the body work. It could be, and it's different for everybody because you are a population of one, you have your own set of conditions and symptoms and things that, and treatment goals. And so, and a unique history. So it could be a trigger point pressure release. It could be regular massage techniques. It can be muscle energy techniques where you're actively participating. It could be stretching. I incorporate frequency-specific microcurrent with every session when it's appropriate, and I can explain that too. I do a lot of active neuromyofascial release, which it gets the brain involved while you're doing an activity while I'm at that trigger point, and it's very, very effective. And then one of the things that's really important is figuring out the movers and stabilizer muscles. So the stabilizer muscles are, I help people try to find and engage those stabilizer muscles. And sometimes with that, a lot of their problems just disappear. And then I end everything with self-care education. So I teach people how to find and treat the muscles and find the trigger points and how they can treat them at home. And so it could
Fantastic.
be any of those things or sometimes all of them. So a lot happens in a session with me. It is not a lay on your back, relaxing, flowy massage, but it is very relaxing because of the microcurrent therapy.
Great. So why don't you tell us a little bit about the microcurrent and what that is?
So microcurrent is a highly effective for treating muscle, nerve, and joint pain. It's a low level current. It's the same level of current that you have in your body, so it's subsensory. You cannot feel it. Um, but what you can feel are the results. So the softening of the muscles, the relaxing of the fascia and other tissues. And it's called frequency specific microcurrent, meaning there are specific frequencies for each body tissue. So depending on what your treatment goals are, what your symptoms are, I can customize that to help you relieve your pain. It's good for pain, just relaxing muscles, and it's helps heal tissues faster. And it's one of the things, this is my secret weapon. It melts adhesions and scar tissue. So majority of the people that come to me have some kind of chronic issue that they've tried everything and nothing's helped, or they've tried something and it helps for a while, but it comes back. And that's because after you have an injury, you have inflammation, and then adhesions and scar tissue form. And they stay there. So they stick your tissues together. and it can cause pain or restricted range of motion or a number of symptoms. And I can go in with the manual therapy and microcurrent and melt these adhesions and scar tissue so that your tissues can actually move the way they have supposed to, have the space, and you can heal yourself. And that's for chronic issues. It's also really, really great for new injuries. So I have a lot of athletes that love it because they can just do a post-workout, post-event treatment and get those muscles and tissues back online. And so they can get back in the game, be ready to go the next day. But anyone with a new injury, it's very beneficial. So like post-op, I have a lot of post-op recovery that I can do. And I can go in depth in the science behind it, but that would be another day, I think.
Maybe that'll be another interview. Yeah.
Yeah,
Well, that sounds pretty incredible. Can you give us just a few examples of some specific ailments or conditions or types of injuries that you've worked really well with or that respond really well to these kinds of treatments?
So that is a tricky question to answer because I like to say, give me anything, and I will say there's a trigger point for that. So, or there's a frequency for microcurrent for that. I do get a lot of neck and shoulder issues, pain, and like frozen shoulder, headaches, post-concussion, um, sciatica. Um, I've had a lot of plantar fasciitis this year
Mhm.
and ankles. But yeah, anything head to toe that's related to muscles and fascia. There's a trigger point that's responsible for a lot of it, and there's something going on that I can help with microcurrent. So it's hard to answer that question. I help a broad range of conditions. One of the ones I'm really excited about recently is hypermobility and Ehlers-Danlos syndrome. There has been some really good results improving a lot of the symptoms of these conditions with the microcurrent and trigger point therapy. And I actually presented a case study on it about a month ago at the Wellness Expo. And so I'm really excited. We should probably do something to share that with people or have some kind of
Definitely, we can do that.
shop or something because I would love for people to be aware that there's treatments out there that can help.
Absolutely, right? Because there isn't a whole lot known about how to help people with those conditions other than maybe some physical therapy. So that's great to hear.
And I do get a lot of people that have a lot of, complicated things come to me. So that's part of kind of how trigger point and microcurrent work. We draw in unique people, but yeah, yeah.
Great, great. And then why don't you tell people how they can find you or where, let's say, start with where they can find you and when and how to get in touch with you to schedule an appointment.
So I have a website and it's on my, yeah, we can post that. But I do not offer online booking. I do by appointment only. So my number is 808-264-4347. And the reason for that is because I do the phone consultations and get all the details. And I'm not a regular massage therapist, so I want to make sure people know what I have to offer and that I can help them. And I am in Grand Junction Monday through Thursday, and in Ridgeway Friday, some weekends, and some weekday afternoons. And that can all change. I have gone places for emergency sessions. And I'm also available for events and outcall if you need me to come to your home for like post-op. But yeah.
Great, great. Thank you. So yeah, I will put your website and your contact information in the email with this video as well, so people can find you. All right, and then we'll have to figure out another time to discuss some of the details about microcurrent and hypermobility and yeah, all the many other things that you do.
Okay, thank you so
Yeah,
much.
yeah. So reach out to Carrie if you're needing help with anything musculoskeletal. She has a broad array of tools that she can help you with, and let us know or let her know if you have any questions. And thank you so much for being with me today.
Abigail.
All right, bye.
Bye.